2:30. We officially call the Ottawa County Community Mental Health Board of Directors to order. Someone that would be so kind to do an invocation.
I will for you. You bet.
Thank you.
You bet. Shall we pray? Dear Lord, we come to you on this board meeting of October for the Ottawa County Mental Health. Dear Lord, guide us as we discuss items that affect people's lives, some for long term, some for short term. Dear Lord, may we think of how that affects them when we make our decisions. Guide and protect us for Jesus' sake. Amen.
Please note our mission and vision statements. There will be 2 opportunities for public comment. One is now. Please give your name, your address, and limit your comments to 3 minutes, please. So if there's someone in the audience that would like to address the board, now would be the time. Well, everybody else is staff, so
Yeah. You may do, yeah.
either one or both.
So hi, I'm Allison that invited me here, and this is Connor. We just moved to the area. We work with an organization called the Epicenter. We promote the well-being, mental, physical, emotional well-being of kids. So a bit about our work. We suggest that we come here and introduce ourselves to you all and let you know that we're here and we're open to collaborating in any way that we can.
Oh, great. Well, welcome. Very nice.
Do you have any information that you can leave with us?
I have a card and I also a children's book that I wrote that I can share with you all.
Sure,
that might
thank
be
you.
something- At the end of
Okay.
thanks for having us.
Thanks for coming out.
Next, we'll move into our consent items. A is our agenda for today, October 17th. And B is the minutes from September the 26th. So we'll entertain a motion for the approval of both those.
Supported.
Make the motion.
There's a motion by Jim. And support
How
by
am I
Al.
supposed to take minutes with this meeting?
Is there any further discussion? Seeing none, all those in favor of approving consent items, indicate by saying aye. Aye. Those opposed? Next, we'll go to the presentation, family service update. And
Hi, everybody, I'll come join the table, so I'm a little bit closer to the microphone, assuming that's all right.
absolutely.
All right, Patricia's got a PowerPoint. And it's great to meet people from Epicenter. I would love to connect with you afterwards, since I'm a program supervisor for Everything Children. Absolutely. So for those of you who haven't met me before, Ann Hurdy, I'm the program supervisor for family services here at CMH. So that's all of our services for children birth up to the age of 21. I have now been here for 14 years, which I can't believe it's been 14 years. So anyway, so I thought I would just connect. And last time we were here, we talked a little bit about our system of care grant. So it's been a while since we've provided an overall update about what's happening in family services world. So I thought we would just kind of get started. This first one, kind of showing it because we've been talking about how much family services has expanded over the last couple of years. When I first started here, we just had a handful of therapists, and now, as you can see, we have quite the large flowchart configuration for staffing. So as we dig a little deeper in that, we've got the following sort of configuration right now. Included in that as well, we've got outpatient contract agencies, 6 of them that provide contract outpatient and infant mental health, 1 contract agency for wraparound, 12 contract agencies for applied behavioral analysis, 3 contract agencies for fiscal management services, lots of respite and camps, Community living services, I put 4. We have more contract agencies than that, but 4 of them that also work with IDD adult services also work with family services. And then we've also got some contracts with ancillary therapies for physical therapy, occupational therapy, speech, and rec therapy. So at our current configuration, we have 36 staff, and then we have those contract agencies listed. So we have grown tremendously over the past couple of years. The reason for that is the number of youth coming in the door has grown exponentially, particularly over the last 4 years. We started to see that happen prior to COVID. So certainly given what's happening with COVID, what's happening with kids being in school, out of school, hybrid models, all that other type of stuff, it certainly is no surprise that we've seen a notable intake or uptake, excuse me. So currently we have about 640 kids open to us in family services. That's certainly one of the highest numbers in the 14 years that I've been here. So right now we're continuing to go between 640 and 660, and we've been hanging out there for about 6 months now. So it's a notable increase. Half of those youth are related to seeking services for applied behavioral analysis. That is the MDHHS mandated service for children who are on this autism spectrum and who meet the state's criteria. So approximately half the children that are open, and by children I mean birth up to the age of 21, are somewhere in that pipeline of services. That might mean they're waiting for the testing to happen because of that many new kids coming in. You have to have specialized people do the testing, or we're waiting for the state to approve. The state process for approving has actually become a lot slower lately. The good news is they're actually going to get rid of that approval process April 1st, we're being told. Or we're waiting for BCBAs, which means master's level clinicians, to be able to work with the families to actually implement the ABA service, or techs. It's kind of another word for like a CLS worker, somebody who is in the home or in the center working directly with family. It is not a surprise that there's a waiting kind of pool of kids right now for that, because just like every other service in the behavioral health field, which I know you've seen this a lot recently at board meetings, there's just not enough staff out there, particularly given the influx of kids coming in at the rate they're coming in. The other half of that 640 are in therapy of some sort, whether that's home-based therapy or outpatient therapy. And then certainly there's additional use served through the crisis team, but I don't have those counted in that open 640 kids. So as I noted, the number of youth coming to CMH continues to be notable. So this is new to CMH coming in the access center. So families are either walking in, most of them are calling ahead of time, setting up an appointment and being screened by the access center. Sorry, I've been on too many phone calls today, to determine eligibility. So the family services, that 0 to 21 group, is the blue line. MI adults is the orange, and then IDT adult is the gray line. And as you can see, on an average, certainly the blue line is continuing to be higher. Years ago when I started here, it was definitely MI adult, which had a lot more people coming in, and now we have certainly turned that a couple of years ago, and the trend is not changing at all. I will also note it doesn't include transfers from other counties or people returning within several months of closing. So if a child is already getting, say, ABA, applied behavioral analysis in Kent County, they move here, we automatically have to accept them and put them into our system. So, but I thought this was kind of a helpful number to kind of see what rate we have of individuals coming in and actually meeting our criteria. A few other trends, I'm hoping these might be helpful as well. So this is the CAFAS data. CAFAS is the Child Adolescent Functional Assessment Scale. It's a tool that is mandated by the state, and we use it to measure how children and adolescents are functioning, how they're doing in school, in home, community, behavior towards others, what's their moods and emotions, substance use, self-harm. And then specifically, this data is used for kids that we identify as seriously emotionally disturbed, which I hate that phrasing. That is the label, though, that the state puts for those kids. It means they're more of our kids with mental illness, such as depression, anxiety, trauma issues, and also certainly lots of our children on the autism spectrum group meet within this criteria as well. So we've been looking at what does that data look like? And these are the 3 points of data in this graph that we're really trying to pay attention to, is how many youth are experiencing a serious suicide attempt within 3 months of coming in our door. How many have been possibly suicidal within 3 months coming into our door, and then aggression. And we're specifically targeting those three because those are the areas where we feel like we need to, one, have the most expertise. Two, those are the ones that we take quite serious because certainly we're aware that, harming self and harming others is something that would necessitate for some youth inpatient. And we also want to make sure that we're targeting staff training to be able to provide appropriate training for staff, whether that's in-house or contract agencies, to be able to meet the demand and the needs that we're seeing. Average age of kids been hanging pretty steady over the past couple of years. Average age since I've been here for 14 years is 12, and we are certainly holding right within the 11 or 12-year-old mark. So, and then even our average intake score for the CAFA, so again, those 8 behavioral domains that we're looking at, holding pretty steady as well. So we're feeling okay about that. And we look right in line as well with that one, with the state average, both for the average age and the average intake score. So when we talk about the number of kids coming in and what's happening, like I mentioned earlier, I know this is not new in terms of everybody is having capacity challenges. So we are certainly doing our best to make sure that every youth that walks in the door and who's eligible for CMH is getting connected to some therapy, some type of support, so the family has someone to walk alongside of them during these times. As I mentioned earlier, the applied behavioral analysis capacity is a notable issue, including the lack of social skills groups for youth within that group, and then also lack of center-based. We have lots of families who would like their older youth to go to a center rather than having treatment in the home. And that's a really hard group of kids to find center-based for. Right now, the only centers we have like to keep birth to about 10 years of age. So they don't want to serve those older kids in the center, which I also respect, because depending upon behaviors, it might be a lot tougher to find staff to be able to manage some of those behaviors that you might see in those 14 to 21-year-olds as well. Certainly a challenge with respite and community living services. There's a lack of providers, and we are doing everything we can to support families to use the self-determined opportunities that are before them, providing them support so they can identify and hire and use their own staff. Our regular therapy issues, capacity always is a challenge with outpatient and home-based. We've also had a lot of challenges with youth with commercial insurance can come to CMH, and I could talk a lot about all the billing rules and how to do that stuff, but I won't bore you with that part. But it does present some interesting challenges for us about making sure that we have enough therapy agencies that can also work with those kids with commercial insurance and Medicaid as secondary, because that brings about a whole bunch of financial challenges for our agency as well. Certainly wraparound and supports coordination. And we've certainly been having lots of ongoing conversations about staffing configuration needs and that other type of stuff. So I've been very appreciative of all the support we're getting in the family services world, recognizing that with this high demand, we're going to continue to look at creative ways to address needs. So, and then just wanted to highlight some other community supports or community involvement that we're doing. We've got that SAMHSA System of Care grant. It's a 4-year grant. It started August 30, 2020, and it continues through August 29, 2024. So we are technically in year 3 of that grant. I can assure you by the end of this year, though, we are definitely going to be putting our numbers together and doing some planning, because we are going to apply for another 4 years. At this point, we have exceeded all of the benchmarks that we said we would set in terms of number of children served, number of community partners served, number of therapists trained. So we're feeling really good about where we're at. And so we are going to be very hopeful that we are going to get another 4 years, because there is definitely a continued need for this grant. What are we doing with it? We're providing free community education and training. That training is for parents, for youth, for schools, community at large, for therapists. Some examples of that is we're providing free evidence-based training for therapists. There's a lot of therapists in this community that serve children and adolescents, and they've expressed concerns knowing the number of kids that have some sort of trauma challenge or trauma history. And so therapists have said, hey, we'd like some training. And so we're providing free evidence-based training for them. So we feel really good about that. We're training school social workers. On Friday last week, I trained 42 social workers on how to help get kids connected to supports and services throughout the community, how to do mental health screenings, how to do basic case management. We're doing parent training on trauma as well. Another big part of the System of Care grant is encouraging and supporting youth and family voice in child serving agencies. So whether that's juvenile court, child welfare, foster care, the ISD. So we've been supporting families to attend trainings where they can learn what's the IEP process, how do you get special education services for your child. Sometimes we're going along with families to those meetings as well to be a support and advocate for them. Another fun example is that our youth peer, hosted an event with juvenile court, and juvenile court put on an event. WZZM was actually there, and allowing kids from the juvenile court system to share their stories and how impactful it is to have a voice in their system. So we're really excited by that event. That drew out quite a few people. We're also in partnership again with those same youth serving agencies, but also all of our contract agencies and some other ones as well, to kind of do an evaluation. We're using TDD that we have a contract with here at CMH to evaluate what are the strengths and opportunities of youth serving agencies throughout Ottawa County. What's going well? What are we seeing? What are the trends? How do we all work together? There's definitely a sense, right, that with the number of children and youth and families that are having a variety of struggles, that we want to be in collaboration together, because we don't need to be in competition. There are more than enough children and families that need supports and services. So we're working on that. Part of the grant also allows and encourages an outreach within the Latino community, supporting youth, accessing mental health services. We've got a partnership with Bethany Christian Services, where they're receiving part of the System of Care grant to do targeted attempts to reach out to Latino youth who might not otherwise come to CMH, and we're finding that to be really successful. And then we're also doing an anti-stigma campaign. We're recognizing that with the help of Rebel, that's another contract we have here at CMH, we're trying to do a public service campaign that says it's normal to have mental health. Everybody has mental health. It's normal to go get supports and services. And what does that look like? And so it's been a great partnership and another great opportunity for parents and youth to say, how do we advertise and promote that it's important to recognize we all have mental health, and some of us, lots of us need help at some point or another. So it's normal to do that. Lastly, just a few more partnerships that I want to highlight on the next slide include the mental health JJ PAC grants. That's a partnership with juvenile court and other community agencies. Again, it's another opportunity to provide free mental health screenings and short-term case management for youth in the community. We're also doing a lot of case consultations, given the increased need for and challenges with youth and their mental health concerns. Lots of agencies calling us, asking us to kind of help through what treatment makes sense, what protocols. We're working with the schools right now to help them develop protocols as well. So we've done a lot of case consultations. Related to that, with the Ottawa area ISD, we're doing lots of trainings again for school staff. We continue to partner with the Ottawa Community Schools Network, OCSN, which is also a recipient of millage funding. And we've been working with them for some time. Continue to provide now developing a crisis response system. Lots of schools are experiencing concerns with youth who might be a threat to themselves or others. Certainly last year we saw some concerns as well with school shootings. And so we've been working closely with the ISD to help them come up with some protocols, to come up with some screenings and assessments to help them identify youth who might be at risk, and then what schools can do in partnership with other agencies. And there's other partnerships as well: SCAN, Thrive Ottawa County, IH Ottawa, DHHS, Juvenile Court, etc. So yeah, we feel like we're trying to keep our hands in lots of different places and stay connected, and certainly be a resource for not only youth and families who come in our door, also other youth serving agencies as well. So, any questions or wonderings about that? I know I threw a whole lot at you, so I wanted to respect my time limit. So
I just want to say thank you for all your work. I really appreciate it.
you're welcome. Thanks.
The IEPCs that you're working with the school districts, how often do you struggle finding to do a psychological or a psychiatric for that purposes? Is that something that comes up where you don't have the staff, or there's a delay in those services because of that psychological or psychiatric?
Great question, Matt. So when it comes to schools doing a 504 plan or an IEP, right? So accessing special education services, the school is responsible for providing that psychological testing. So generally that has not been a barrier. Schools have certainly received a lot more funding recently to address youth mental health. And so that is the way they're doing that. One of the things we're intentional about is making sure that if a youth is in our system and they're going to be tested, that we're providing all that testing that we have, because we definitely have some youth who already have some psychological testing. Our psychiatrist has met with them as well. So we certainly kind of walk hand in hand to provide them with all those resources so they're not duplicating testing and they're able to get that process going as quickly as possible. So, yeah. Absolutely.
You said the average age of the kids is around 12, and that hasn't changed. Okay, okay. I don't understand why 12. What do you think? Why 12? Why not 7? Why not 14? You know, what seems to be that magic number?
That's a great question, Al. I think it's a couple of different things, knowing it's been going on for 14 years. One is we certainly see about 5th or 6th grade, lots of schools saying, I can't do this anymore. They've gotten bigger, right? They've gotten bigger. They, youth children 11 to 12, right, are starting to figure out, right, like, oh, I'm going to be an adult someday and I want to exercise my right to control my life. And so generally parents in schools who are making those referrals are saying, yep, they've gotten bigger and now they're starting to push back and we need some more support in that way. We're also seeing a lot of kids who 11 or 12, that's when a lot of us go through puberty, right? And all those life changes that come with hormones and our personalities develop and everything else. For some youth, that actually brings about quite a bit of the challenges that come for them, right? Is there's a whole lot of changes happening in their bodies. And for some, that's a really good thing. And for some, it's confusing. I also think that as kids are getting a little bit older, there's been a lot of emphasis in the school in that upper elementary age to also encourage kids to be able and families to say, my kid is struggling here. How about let's get some mental health services? So honestly, I think there's probably a host of reasons, but yeah, it has been fascinating over the 14 years here that we just kind of hang out at that 12, which again, right, is going to cover any littles from birth to 47 in infant mental health up to those youth in S21 as well.
Do you find that technology and mass media complicates all that?
Yes. Yes, absolutely. We are seeing a lot of challenges with technology, media, social media, you know, all that other type of stuff. And it's been hard. Schools have needed to, right, for safety reasons, have youth using tablets and laptops and all that other type of stuff. So one, we're encouraging and promoting youth to access all this great technology that we have, right? We've done the same thing here, right? Let's do therapy sessions over Zoom when we weren't able to do some in-person stuff, or families chose not to do in person. And so we've got lots of youth who are connected well to their devices. And unfortunately for some youth, right, then that really kind of puts some of those barriers in place about how do I relate to people one-to-one? How do I have conversations? Or one of the things we talk about is for some youth, right, I'm going to do this, right, they're texting, right? And so for some youth, we don't even learn how to write complete sentences, because when we text, it's a lot of abbreviations and all that other type of stuff. So we are absolutely seeing that be a challenge. We definitely have some parents coming in saying my child is addicted to technology. They won't put it down. When we try to make them put it down, we have World War X at our home and things are highly dangerous, very dangerous. So we're working with families as well, right? How do you kind of rein some of that back in a little bit, encourage families to have family time, encouraging parents to put systems in place so their children are earning access to media, computer, tablets, all that other type of stuff. Particularly because so many schools, even in person, are using tablets on a regular basis rather than textbooks and papers and all that other type of stuff. So it definitely feels like it's kind of a tug of war for some families, and for some families it's not such a big deal. For other families it is absolutely huge.
And what about technology? That comes across.
It does. We've been working with the Ottawa County Sheriff's Office, so they have done multiple presentations for us to help us and then to help parents. So we've done lots of parent trainings as well to say, here's what that looks like. Here's how you can support your child. You know, here's conversations to have with your child to be able to explore, are they experiencing that? The schools have been doing that a lot as well. So yeah, we definitely have a lot of youth who have felt like they were the victims of that type of social bullying. And we've also had some youth who have engaged in that type of bullying behaviors. So that's a huge challenge, I think, for kids across the entire world right now, is that
When
family.
they find that information.
Parents can, yeah, absolutely.
Where do you find that information?
Yeah, we have lots of handouts, and then the Ottawa County Sheriff's Office actually has some really great stuff as well. So I can make sure that we maybe put that on our website or add it to.
Okay, thank you.
Any other questions?
That's good.
Yeah.
Very good.
Thank you all for your
Thank you.
time. Appreciate it.
Your work.
Mhm.
Next, Rich, you can give us our dashboard report? Oh, no. Oh, no.
Oh, green.
New TV.
Okay, so this is
Oh.
attachment A, and it's our quarterly members report. I'm gonna go over the April to June data. As you'll notice, it's not as bad as the previous quarter. We have a couple of yellow highlights in there. That just means that we're close to target, but we didn't quite make it. We're moving in the right direction. We are out. I'm gonna start with indicator 4A, which is the percent seen within 7 days of discharge, inpatient discharge. And for the kids, we actually had 92.3%. There was 15 discharges from inpatient. We had 2 exceptions there. So there was a total of 12 consumers that received a follow-up within 7 days. So 12 of 13, 92.3. So we are out of compliance on that. We're watching this metric pretty closely because the previous 2 quarters we've struggled with it. So I know that Anna's been working closely with the team as well as with Cal to look at, what's causing that. And then the other is for the adults, we are at 94.3, again, close to the 95% mark, but still out of compliance by 0.7%.
Rich, question, why are the diversions between children and adults? Is it just because of staffing or is it specialized staffing for children?
No, I think that's just the way that it's split out, you mean?
No. I mean, like in April, June, it wasn't such a big deal, but when you come to October, December, there's a big divergence between adults and children, like 97 versus 85.
So again, it depends on like the size also of the sample that comes in. So it may not be a big N, so I don't really look at like from 1 month to the next necessarily in terms of trend, because we could have 4 consumers that came in for services and then 2 of them will be out. So that would be a big percentage.
Oh, okay.
So it really just varies on the numbers. So I do believe in January to March, it was a much smaller sample size than the 15 that we had this quarter or this April to June. So as far as the adult for the 7 days inpatient discharge, there was a total of 41 discharges. And so we had 6 exceptions. So 33 received a follow-up within 7 days. 33 of 35 then is 94.7. I'm going to go back to indicator 1 up on top. So we did really well on that. So that's a 3 hours of pre-admission screening for disposition, 3 hours or less in children and adults, 100%. Indicator 2A and indicator 3, there is no benchmark. That's why it's not highlighted. Yeah, I think I've mentioned that before. I went to the CIO forum last meeting. They talked about MDHHS is already starting to form the core group that's going to start setting the benchmark for these. So meetings are going to be starting soon, but they're going to invite other CMHs to participate and PIHPs to participate in that discussion as well. And then towards the bottom, indicator 4B and 10, we are in the green area, so we are meeting expectations there. Any questions for the members dashboard? Good.
Thanks, Rich.
That's all I have.
Old business, we don't have any old business. Our new business, which is our service contacts.
So if you look at your electronic version, that is incorrect. Your attachment fee is going to be your packet. That was going to be registered. I added a few. You don't notice those things until 30 minutes before. So the first 2 items on the list are 2 residential homes that we are adding. One is new for Vet and AFC. It's a new provider that we have a consumer being placed at. And then the second is the addition of a home for Dignified Ascension Health. So we currently have a contract with them, but adding one of their homes to our contract. The bottom 6 are all current contracts, residential, that we are amending to provide residential millage funding, one-time payments for fiscal year 23. That covers October 1st through September 30th. The amounts are all listed on your new piece of paper and are correct.
Any questions?
All the millage dollars are kind of a bonus to the organizations, or how is that? I'm just trying to.
So it's not a bonus. A couple years ago, we call them really stability payments.
Okay.
So our largest residential providers in the county were coming to us and telling us they were really having trouble making ends meet between what they were able to collect for room and board through the consumer's SSI or SSDI payments. And they expressed a need, that they needed more dollars. Medicaid can't be used to pay for room and board. So that was the beginning of this program. Once COVID hit and the staffing crisis really became an issue, most of those providers were letting us know that they were finding it incredibly difficult to, again, have ends meet due to the need to pay overtime, which the pass-through that we get with Medicaid cannot be used for overtime. They're also having to really beef up their incentives, like sign-on bonuses and retention bonuses. So those dollars are intended to go for those two purposes.
Lynn? Medicaid cannot be used to pay overtime, right? Is that what you said? I mean, okay, so what would be the administrator of Medicaid? What would be their solution in what we're having? What are they saying should be done?
So the dollars that can't be used for overtime are the direct care pass-through, the $2.35.
Yep.
What the director's remedy for that, they didn't offer one.
Okay, so we're using some of our millage money to offset some of it,
Yes.
right? Okay. So if the millage goes away, what happens then? Are we in a big hurt?
We are in a big hurt. Our providers would sorely miss this money.
Okay, because it's not coming from the state.
No.
Okay.
I think we're gonna need a motion in a second for approval of the service contracts.
Supported.
Any further questions? Comments? All those in favor of approval of attachment B, indicate by saying aye.
Aye.
Those opposed? That motion carries. And our executive director's report.
Alrighty. So you may have noticed that we didn't have financial reports this month. That's because it's the beginning of the year and there isn't much to report in 3 weeks. So Amy promises that she'll be back next month with an update. I wanted to give you some information from the state. I sent everyone an email this morning that included an action alert from the board association. What we're hearing and what they're hearing in Lansing is that Senator Shirkey and Representative Whiteford are meeting and maybe submitting a draft of a compromise bill that would combine the Senate bill and the House bills From what, again, people are hearing, it would move all of the Medicaid funds for children's services, including autism and foster care, over to what could be a private health insurance company. And in addition to that, they would look at creating one statewide entity that would take the place of the current PIHP system. I don't have any other details for you about that. And to me, that's fairly alarming that this could be pushed through, or that the attempt could be made to push this through during lame duck. And really the people who will be most impacted by major changes like this, those are our consumers, and the organizations that help care for them won't have any input on a new compromise proposal. So if you're inclined to, the email link I sent you includes a really easy way to contact our local legislators and let them know what your concerns might be or any questions you might have. So happy to answer any questions for you about that issue. If I hear anything, any updates, I will certainly pass that along. The public health emergency, I don't know if everyone knows, but it got extended through January 11th, 2023. So that's important to us, because once that order goes away, we will likely see some pretty significant changes in our Medicaid enrollments, which is what our funding is based on. So I don't have a whole lot of updates from the Lakeshore Regional entity. We did get final rates, Medicaid rates, and our region, the rates were reduced in our region. I think I let you know that Mary, the director, is looking at potentially contracting with another actuarial service so that we can, in the future, be better prepared to ask questions about that rate setting process, because it seems like for whatever reason in our region, our rates see the most fluctuation. We should be okay for next year as far as finances and revenues go, because one of the big places where significant funds were going was that contract with Beacon that has ended, and also funding the ISF. So we should be right about the same this year in regard to revenue, but what that means is any increases in spending is going to be very difficult for us. And I've already explained to you that many of our providers are already asking for rate increases, has everything to do with staffing and trying to stay on top of those rising costs as well as inflation. You know, we'll keep a close eye on that throughout the rest of the year. From CMH, we talked about some of the millage dollars that are going out to these contracts. Another new program I think I've mentioned a couple times that we're going to be launching is a community partner outpatient program that we're going to be spending some of our millage savings on. We're planning on contracting with 7 of our local mental health providers. 2 of them we already have contracts with. Really the intent there is to get more outpatient counseling services, school counseling services, and some parent education available out in the community. We do have another new board member. Stephen's fairly new here, but Dorothy Hendricks will be, she couldn't make this meeting, but next month she'll be with us. So at this point, we have all of our positions filled. So I'll definitely introduce you to her at our next meeting. I wanted to let you know that I appreciate you guys moving this meeting up. Part of the reason we did that is because the Board Association Conference takes place next Monday and Tuesday. I am presenting at the conference along with one of our social rep programs, the Momentum Center. So I do appreciate your flexibility with that. And I think that's all I have for you today.
Did you want to mention the possibility of the ARPA dollars going to
Mhm.
going to the special program to provide
Yep.
psychiatrists?
Yeah,
That's kind of cool.
it is cool. Well,
If
and
we
it'll
can
be,
pull it off.
I was gonna say, it's gonna be even cooler if it actually gets supported and funded. But
Well, you've got Jim here. You've got Zach here,
Yeah.
Al's here.
so I think I mentioned that they invited me to sit on the Human Services ARPA committee and really good conversations. There were lots and lots of people, organizations who applied. And one of the areas that we have pushed forward for consideration for funding is some dollars that would go to help recruit psychiatrists. There is a shortage of psychiatrists really nationwide, statewide, and in Ottawa County, not just CMH having difficulty, but really anyone who employs a psychiatrist. So that's hospitals, Pine Rest, Intercare, among others, who find it especially challenging to find those MD psychiatrists. It's even more difficult when they're board certified to see kids. So the proposal is to set up a fund that would help recruit and retain psychiatrists by providing a yearly incentive. 25,000 for a psychiatrist who is certified for adults, and I think it was 30 a year for a child psychiatrist. So that would be lovely if it gets funded. I think it could definitely make an impact in having more people, more of those professionals come to our area. So.
That's it?
Mhm.
Okay, well, thank you.
Mhm.
Next is general information, comments, meetings attended. This time has come up for evaluation of Lynn. And I think you can pick up either a hard copy or you can do it online, but that would be completed and all packaged by our next board meeting in November. Is that pretty accurate, Patricia?
Yeah, I think I gave you a date in the email. I think I said,
You want it by?
Yes.
did I say the 15th?
November.
Yeah,
I thought it was the 21st.
that could be. That's it Monday. Yeah, the week before. So, and that is Thanksgiving week. So that's where.
So while you're in a deer blind.
While you're in a deer blind,
you
event,
filling
yes.
this out?
Good, yeah, really, yeah, yeah. It's
Yeah,
gonna be hard to
so-
send it.
And I did print off some hard copies. I'll get them for anybody that wants them afterward. So,
Anything else for meetings attended or comments? Okay. Well, then this is our second opportunity for public comment. So there's a couple public back there if they want to have it, say something else, or if there's someone online that would want to address the board, now would be the time. No, none. Okay. Okay,
Thank you.
thanks for coming. I appreciate that. All right, if there's nothing else, we'll stand adjourned.